Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be answering a question from one of the comments on our YouTube video. So this question comes from Kylie Baker, and she asked, how much do your teeth move with braces, and why do we really need them? So that is a good question. There's a lot to unpack here. So how far or how much do your teeth move? That depends on where your teeth start and where we want to move them to. If you only have a very small amount of crowding, your teeth don't need to move very far, and in those cases they might only move a couple millimeters. But there are some patients that have a dramatic correction needed, and so we'll show a few here. So as you can see in these pictures, these patients had some significant tooth movement. Teeth might move 8 millimeters any direction. They might move forward, back, they might twist. Some patients might have an impacted tooth that we need to pull down. So depending on your tooth problem or bite problem, you might have some significant movement. If you only have minor correction needed, there may not be that much movement. So why do you really need them? Again, this depends on what specifically is your tooth or bite problem. Some patients who only have minor crowding and no significant concerns otherwise may not need braces. It might only be a cosmetic thing, but that's okay too. Cosmetics concerns are real. If you don't feel confident about your teeth, if you don't like the way you smile, if you feel embarrassed to smile in photos, that's good enough reason to get your teeth corrected. It may not be a long-term health implication. It may be more like a cosmetic concern. But again, if fixing your smile gives you confidence to smile and to feel good about yourself, that's good enough reason as well. Same thing with, doing your hair, doing your makeup, the clothes you wear. If that helps you feel better about yourself to give you confidence, it's something that's not a bad thing and it's worth doing also. For some patients, there is some long-term health effects of living with crooked teeth and a bad bite. So if you have a bad bite, it may chip the teeth, it may lead to jaw problems, it may lead to TMJ problems, it may lead to inability to properly clean and floss, which can lead to long-term gum and periodontal problems. For some patients, braces is definitely necessary from a health perspective. For some patients, it may be just a cosmetic, and for many patients, it's both of those. So as far as your teeth specifically, if you have any cosmetic concerns, definitely see an orthodontist for a consultation, and they'd be able to advise you, how much tooth movement is needed, if it's necessary for your teeth, if it's just cosmetic, or if there's any long-term health implications. And for many patients, braces is something that's definitely beneficial, and it's usually 1.5 to 2 years of your life. And if you do that, you can set yourself up for long-term healthier teeth and also have a smile that you like, and that is something that's worth doing as well. So hopefully that helps answer your questions. If you have any follow-up questions, ask them below. Like this video if you found it helpful, and make sure to subscribe to the channel for more braces related content, and we'll talk to you soon. Bye bye.